Welcome to RN Academy. If you understand this one topic clearly, you can protect your kidneys, slow disease progression, and improve quality of life. Today we are talking about chronic kidney disease, also called CKD, explained from beginning to end in a simple and practical way. Chronic kidney disease means long-term damage to the kidneys that does not fully reverse. The kidneys are vital organs that filter waste products, excess water, and toxins from the blood. They also help control blood pressure, balance electrolytes, produce hormones for red blood cell formation, and keep bones healthy. When kidneys are damaged over time, these functions slowly decline. CKD usually develops gradually over months or years. In the early stages, many people feel completely normal. This is why CKD is often called a silent disease. Symptoms usually appear only when kidney function has significantly reduced. The most common causes of CKD worldwide are diabetes and high blood pressure. High blood sugar damages tiny blood vessels in the kidneys, and high blood pressure puts constant strain on kidney filters. Other causes include long-term use of certain pain medications, kidney infections, kidney stones, autoimmune diseases, inherited conditions, and urinary tract obstruction. To understand CKD, it helps to understand how kidneys work. Each kidney contains millions of tiny filters called nephrons. These filters clean the blood and produce urine. In CKD, nephrons are damaged and lost over time. The remaining nephrons work harder to compensate, but eventually they also begin to fail. This leads to a gradual decline in kidney function. Kidney function is measured using a value called estimated glomerular filtration rate, or eGFR. CKD is divided into 5 stages based on eGFR. Stage 1 and 2 indicate mild damage with near normal function. Stage 3 shows moderate reduction. Stage 4 indicates severe reduction. Stage 5 is kidney failure, also called end-stage kidney disease, where dialysis or transplant may be needed. Symptoms of CKD depend on the stage. Early CKD may cause no symptoms. As kidney function declines, people may notice fatigue, swelling in the legs or face, shortness of breath, changes in urination, foamy urine, poor appetite, nausea, itching, muscle cramps, difficulty concentrating, and high blood pressure that is hard to control. CKD affects the whole body, not just the kidneys. When kidneys fail to remove waste, toxins build up in the blood. Fluid overload can cause swelling and strain the heart. Electrolyte imbalance can lead to dangerous heart rhythm problems. Reduced hormone production can cause anemia and weak bones. This is why CKD increases the risk of heart disease and stroke. Diagnosis of CKD is done through blood tests, urine tests, and sometimes imaging. Blood tests measure creatinine and calculate eGFR. Urine tests check for protein or albumin, which indicates kidney damage. Imaging such as ultrasound may show kidney size and structure. CKD is diagnosed when abnormalities persist for more than 3 months. The most important goal in CKD management is slowing progression. While CKD often cannot be cured, progression can often be slowed significantly with proper care. Controlling blood sugar in diabetes is critical. Tight blood pressure control is equally important. Medications such as ACE inhibitors or ARBs are commonly used because they protect kidney function. Diet plays a major role in CKD management. Salt intake should be reduced to help control blood pressure and fluid retention. Protein intake may need to be moderated because excessive protein increases kidney workload. Potassium and phosphorus intake may need adjustment depending on blood levels. Highly processed foods, packaged foods, and excess sodium should be avoided. Hydration should be balanced, not excessive and not restricted unless advised by a clinician. Lifestyle factors matter greatly. Regular physical activity improves blood pressure, blood sugar control, and cardiovascular health. Smoking must be stopped as it accelerates kidney damage. Alcohol intake should be limited. Maintaining a healthy body weight reduces strain on the kidneys. Medication safety is extremely important in CKD. Many drugs are cleared by the kidneys and may accumulate if doses are not adjusted. Common painkillers such as NSAIDs can worsen kidney damage and should be avoided unless advised. Patients with CKD should always inform healthcare providers about their kidney condition. As CKD progresses, complications must be monitored and treated. Anemia may require iron or erythropoietin therapy. Bone and mineral disorders may require vitamin D or phosphate binders. Electrolyte imbalances must be corrected carefully. Regular follow-up with blood and urine tests is essential. When kidney function reaches advanced stages, planning becomes important.
Dialysis may be needed when kidneys can no longer maintain life. There are 2 main types of dialysis: hemodialysis and peritoneal dialysis. Kidney transplantation is another option for suitable patients and offers the best long-term outcomes. Living with CKD requires education, support, and partnership with healthcare providers. Early detection, lifestyle changes, medication adherence, and regular monitoring can dramatically slow disease progression and reduce complications. Many people with CKD live long and meaningful lives when the condition is managed properly. In summary, chronic kidney disease is a long-term condition that affects the entire body. It often begins silently, but can be detected early with simple tests. Diabetes and high blood pressure are the leading causes. While CKD may not be fully reversible, progression can often be slowed with proper medical care, diet, and lifestyle changes. Understanding CKD empowers people to protect their kidneys and their future.